Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program today. Hope you're doing well. Have a lot of great information to talk to you about and some very cool topics. We'll look at fibromyalgia so we could make some sense of that and understand that it's a term that can include a variety of different symptoms and in many cases caused by other disorders, and maybe fibro is not the right word or term for it. We'll talk about a recall of over 7,000 bottles of a common antidepressant because of potential risk with one of the ingredients. We'll talk about high-risk plaque and why it's important for everyone at some point to do testing of your circulation, looking for plaque in your neck, your legs, look at your echocardiogram for heart function. We'll cover all of that. And then the last topic or article, which I'm going to talk about, maybe a little controversial.
A little bit.
I'm going to figure out how to say this delicately. I'm not taking sides. I'm not making any position statement, but this is a study from WebMD. And as a result of years' worth of comment on this topic, they've done a study. So the question of the study is that, is marriage making your husband gain weight? So I'm sure there are a lot of people out there screaming and yelling and talking about this or that, and we'll get into it. You know, if people want to call in and voice their opinions, you can just be very kind with your comments. Not to me, to your spouse and, to your family, but this is a great topic to talk about. So without further ado, we'd love for you to come on and give us a call, a chat, 800-420-9272.
888-888.
888. 888-420-9272. That's 35 years of being on the radio. That 800.
That'll do it. And I'll start off with, we already had a question right off the gate from Instagram.
Wow, look at that.
Real quick, so before we get into the article.
Okay.
Hey doctor, my doctor told me that my kidneys are dry. I drink about 64 ounces of water every day. What does that mean?
Kidneys are dry. It's not really a medical term, so it doesn't really describe anything specific. If I see a person that has a kidney issue, we usually talk about creatinine, which is a marker of kidney function, and GFR, most important, glomerular filtration rate, how your kidneys filtering your blood and taking bad things out of your blood, waste products or end products of metabolism, and putting them out of your body through your bladder into the urine. So those are the things that we focus on. GFR in a perfect world would be over 90. A lot of people come in lower than that, and we have to track that because if it keeps dropping for a variety of reasons, we don't want that to happen. Traditionally, when people have a really bad GFR, doctors may talk about, at some point, putting them on dialysis, where they stick a shunt in your arm. It's really not the most comfortable thing, and then they have a machine that just filters out your blood and takes away all those waste products of metabolism. That's a big issue. But for people that have a low GFR, we do stem cell therapy, which works extremely well. So I'm not sure what he's saying with respect to your dry kidney. As you can tell, my comments to patients, as I'm talking to you now and as I talk to everybody, I want people to understand exactly what I'm talking about. So that's why I'll explain things in a much more thorough fashion. And typically when you go to your doctor, you should take notes or, get copies of blood work or things so that you can make notes while the doctor's talking to you so you know exactly what he's trying to say. I'm not sure what he suggested, as a recommendation for that, but be curious to see if you can tell us what he said.
I'll monitor that if she comes up with a response.
Yeah.
For sure.
That would be helpful. For those of you on Reddit, on Rumble, on Amazon, on all the different platforms that we're on, of course, YouTube and TikTok, love to talk with you. Could send your info, email it, text it, however you want to communicate. Frankie's here and he's ready. He's had 2 cups of coffee already. So his hands are moving fast.
A little shaky,
but his hands are moving fast and he's ready to take your questions.
we do have a response from her. She said, my creatinine is a little high.
So the creatinine is a marker of how well you're able to filter things out of your blood. So the creatinine going up means you're not filtering as well. So you don't want that to go up. And you're drinking a good amount of water, so something else is there that's creating that effect. Be curious to see what your GFR is, the glomerular filtration rate, to see if that's declined some. But remember, one blood test out of, what I normally do is 25 pages and a couple of hundred blood tests. And our initial workup would give me a much better picture as to what your body's doing. I don't know anything else about you other than the fact that your creatinine is going up. So we'll be curious to see what else is happening, what your symptoms are, the rest of your blood testing. That would give me a much better picture.
And feel free to call the office.
Yeah, absolutely. The office is 516-794-0404. It's in Garden City. Our website is drcalapai.com, CALAPAI.com, CALAPAI. I know I talk fast because my brain's working in overtime.
That's why we got the graphics.
Yeah, so perfect. Yeah, so, people will ask a question about one topic or one blood test. We need to look at a variety of different things. I'd also want to look at urine for heavy metals to see if that's affecting your organs, your kidneys, because that's an absolute. We see that all the time. There's tons of literature on that, heavy metals causing damage everywhere in your body. So we have to look at that. Traditionally, doctors never look at that. Okay, let's talk about fibromyalgia. This is a disorder that confuses doctors, and in many cases, doctors will give the constellation of weird symptoms and the name fibromyalgia because you have multiple areas of aches and pains. Typically, I think the name was created because doctors couldn't figure out why you had multiple areas of aches and pains, or were tired, achy, had some brain fog, any number of things. And then a drug company came out to make a drug for it. So it was great for a drug company to have a new thing to make a drug for and sell billions of, capsules of this or that. But there are some characteristics that seem to be similar, but I'm not one to say these are the only things that we look at to try to make a diagnosis. So the comments in this interesting study talks about people being female as opposed to male, more common. That may not be exactly true. And when they try to categorize, I just have a bit of an issue with that. But I wouldn't want to say, well, you're a man, you can't have fibromyalgia, So middle-aged or older, it's also not necessarily accurate because I've seen people that have had what's called fibro at younger ages. Some people have mood disorders, anxiety, depression, PTSD, people that rarely exercise, other family members might have it. Other conditions that may be similar, which it might really be instead of fibromyalgia, would be rheumatoid or osteoarthritis, lupus, ankylosing spondylitis, disc degeneration, irritable bowel. The symptoms of fibro: muscle aches and pain, burning, twitching, tightness, pain in your arms, head, legs, chest, back, belly, butt. It could be aches and pains and issues everywhere. But, you could have back pain from disc degeneration. And I've seen this. People that are very active may have a disc issue in their neck and their low back, and they've got issues, pain and discomfort going to their arms, their middle back, their legs, sciatica. So I rarely ever use the diagnosis fibromyalgia. Other doctors use it, but I've been able to find other things that are creating those problems. And then as we work on fixing those things, the problem goes away. And people can get off the medication that's usually meant for fibro. So allergy plays a role. As I say, disc degeneration, neurologic issues play a role. Some people end up having inflammatory, cascade that's contributing to it that's caused by an autoimmune disorder. So we have to be really diligent in digging for all the underlying contributors. And of course, there's always a psychological override because when you have chronic aches and pains for a long time and doctors can't figure it out, you're not happy, you're aggravated, you're anxious, you're depressed, and you've tried this and that, and there's no appropriate answer coming down the pike. So we have to talk about that as well, which occurs in many medical scenarios where doctors can't figure out the underlying cause. On one hand, I always look for causes, underlying causes, plural, because in so many cases it's more than one thing creating a constellation of your symptoms. And I'm not looking to use a drug just to change your symptoms. So you say, oh, wow, my symptom's gone, but the problem's still there. That's why years ago when the lubricants came out for joint injections, Synvisc, Orthovisc, and I started doing a lot of them when they first came out because it seemed to help people. But then a month or two later when people say my symptoms are back and it didn't really do anything and it's not meant to grow or repair tissue, it just didn't seem to make sense to me. And of course, I was already in the process of doing stem cells for patients to grow and repair tissue. So we segued from just doing the transient lubricant injections to growth and repair with your own stem cells and also with PRP in that. So you want to be as thorough as you can as diagnosing, understanding, and making recommendations for any medical problem. Okay, phone lines are open, 888-420-9272. If you'd like to call in to ask a question, or you'd like to email or text us, we're here ready for your calls.
Got a couple in the pike.
Okay.
All right. Doctor, I'm 50 years old. I've had degenerative chronic neck issues for the past 20 plus years, herniated discs, pinched nerves, severe arthritis. It usually flares up every few years. I've had several x-rays, MRIs, and EMG tests. I've done physical therapy more than once. I've done therapeutic massage therapy, chiropractic care. I've had cortisone shots, and I do daily exercise and stretching routines. And I take various pain meds to help manage the pain. But the pain is now getting worse and is not subsiding. Could I be a candidate for stem cell?
Well, everyone's a candidate for stem because they're your cells, and there's no drawback or side effect or risk by taking your cells from one part of your body, separating them, and then putting them in to create growth and repair. We've done a lot of this for neck and back and sacroiliac, probably more sacroiliac than any other part of the body because that's the big, pivotal or fulcrum point where the weight of your entire body and the movement and the leverage of your whole upper body sits on your lower body. So sacroiliac ligaments are the ones that are worn and used more than anywhere. And injecting those, you're creating more of those ligament fibers to create repair. So that becomes the ideal for that scenario. Your MRI will give us the best description of what's happening, not X-ray, and not whether physical therapy can make a difference because physical therapy works primarily in your muscles. You're not going to have stronger ligaments or tendons that hold you in place and keep you in position from physical therapy. So, and in saying that, I like the comprehensive mechanism of repair. We'll do stem. We'll also put PRP in that because within your bone marrow, there's PRP. But we like to have people do physical therapy, traction, sometimes traction tables, different modalities. One modality may help 10%. Another modality may help 20%. So we want to have everything on board to create your best outcome or your result. Now, if the MRI says that you have central spinal stenosis, which means as that spinal cord goes down in between your vertebrae and it's got a channel that exists in, if arthritis is encroaching on the cord itself, you may need to do a surgical procedure to relieve that pressure on the cord. If it's foraminal stenosis, where the nerve roots come out and the discs are so bad that that nerve doesn't have room to exist and there's constant pressure there, you may need to do a decompression where they cut away some of the bone to allow that nerve to be free from impingement. So sometimes that's recommended depending upon the severity of what your MRI says. Without seeing that, it's hard for me to tell you exactly, what to do. But that's the idea. I want to be able to look at your entire picture, look at the MRIs, and see how much help we could offer you.
We got a more general one here. How frequently can you get a B12 shot, and can you get every vitamin through IV?
You can't get every vitamin through IV. They don't make D or E, for intravenous use, like the fat-soluble ones. But all the Bs, vitamin C, are typically used. Minerals are used. We've done that for the better part of 37 years that I've been in, locally in the office. B12 shots, and this is a great question because it's going to step into a whole different world from what people are used to hearing. So your grandma's B12 shot was always either hydroxycobalamin or cyanocobalamin. That's all that was available years ago. And back then, people got a B12 shot and feel pretty good with it. But then studies came out on the genetics of B12 and the conversion of B12. So Methyl tetrahydrofolate reductase is an enzyme that takes those two types of B12 to convert it into methyl B12. You need that conversion for it to work. So there are many people that I see that don't convert the B12 and are not getting the energy from the B12 they're taking orally or otherwise because they can't convert it. So the MTHFR gene, it's also called C677T. If you have that defect, you're not getting the conversion of B12 into the methyl usable form. So when we do that test and we find that it's positive, we typically give people a B12 shot in the office and see how well they do from the methyl B12 injection. When we do that and they say, wow, I felt good for 2 or 3 days, for those individuals, we may show them how to give themselves a shot, and they can do it 3 times a week initially, so they're getting that energy. They're raising up the B12 that they never really were able to convert, so they'll feel much better. And homocysteine comes down, which is a cardiac risk factor for plaque. And that individual may end up doing a shot twice a week or once a week, depending upon how they feel. You know, if the shot gives them great results at once a week after a while, then yeah, they might be able to do it once a week. So the frequency of a methyl B12 shot depends upon what your body requires. So we're going to get into a whole big conversation on vitamin requirements and this whole new brilliant idea that I had because I was up late, couldn't sleep, was thinking about a few things, and we're going to talk about this in a few minutes. But yeah, the nutrient requirement or the nutrient recommendation has to be based upon what works for you. So going back to grandma's B12 shot, maybe they did it once a month. That's not really going to give you B12 benefit for more than a day or so. I love the idea that we adapt and change the vitamins or any protocol to what the patient needs and responds to. So for those people that do the B12 shot that's methyl 3 times a week initially and they feel great from it, then a couple of weeks later, a month later, we'll say, okay, do it twice a week and see if you still hold that benefit. If you do, great, then do it twice. So it depends upon your result. And also rechecking your blood for your vitamin levels. So great question. Great segue for me to talk about the methylation part.
This is a good one. Can you please help me convince my friend not to go to Tijuana for STEM?
Okay.
It's an easy one.
So there's this hype, there's an idea of going to Mexico and going to various places. Panama, Costa Rica is the place to go for STEM because that's sort of the exciting idea that you can get whatever you want. And it's, you know, just like people will go to other countries to get plastic surgery done because it's cheaper. It's just a bad idea. And I'll explain why. So in Mexico, Panama, Costa Rica, you're not getting your own cells, which your body requires, which your body loves. With your own cells, there's no downside, side effect, or risk. We take them out in a minute and a half, spin them, put them back in. They're brand new, gorgeous cells, no matter what age you are. And we've seen results. And you can look at the videos on my website of patients that are older, 60s, 70s, 80s, 90-year-old patients that we've gotten wonderful results with stem cells for because they're your cells. Imagine when you go out of the country and do something that is not recognized, not allowed here in this country because of all the unknowns. When you're getting someone's umbilical cord or amniotic fluid, you don't know anything about the donor. You don't know their genetic issues. You don't know their infectious history. You know, there are things called prions that are horrible creatures that some people will get, a brain disorder from eating certain food. You're not getting all of that donor tissue screened at all. They're not doing genetic testing because that's expensive in many cases. So you don't know where the cells come from, how old are the cells. Is it a 5-year-old frozen cord? How many cells when, die when it's frozen? How many cells you're really getting? There's no knowledge there. So you're going somewhere where there's no real standard like there is in this country. And you're taking a huge guess as to what you're getting. And your body, of course, could or would reject it because it's foreign tissue. So that risk doesn't make sense to me, especially because the cost is extreme. I've had patients that have called and gone down there to see what it was all about, look at the facility. And one patient came back. She had MS. We ended up treating her. She'd done extremely well. They wanted to charge her $60,000 for STEM. The problem was that, and it doesn't make any sense to me at all, they wanted to give her umbilical cord, but they wanted to give her chemo first. And I said, why would they want to give chemo to a person who already has damage or degeneration of the sheath around their brain cells and nerves, and then do chemo, then do STEM? Why would you do that chemo first? That would be damaging. Makes no sense at all. Maybe they're just trying to charge extra. So typically they charge $30,000 in those places to do this procedure. Again, not allowed at all by this country. And people think, oh, going outside of the country, it's something better. It's not. And I tell the same people, and I've said it many times on the show here, if you've ever watched that TV show Botched, I forget if it's on the E! Channel, Dr. Dubrow and both the doctors.
Say it.
Nassif. Dubrow and Nassif, who are really, really talented surgeons. I've seen what they've done. They have to fix the bad surgery done in other countries, Mexico and other places where people go, because they think it's better to get something cheaper. But, you know, the nightmare procedures that you've seen done, and specific to that show, you know, why would you go somewhere where the standard is not there? You've got the greatest plastic surgeons in the world in this country. And why would you take that risk? And some people are willing to take that risk. And there are people that have died because they've gone to other facilities and maybe they didn't see a doctor or someone else was doing their liposuction. Or it's just, never do that. It just doesn't make any sense. It's too much risk. So at least here you have standards that have to be met. They're much more rigorous. So I would not want to go somewhere like that to do a procedure. You're taking some big risks.
I mean, even if you just slipped on the floor and hurt your ankle on the way in, who you suing?
Yeah, it's just, and I've had patients that have done that. They've gone and spent a lot of money. One of my patients that lives in Connecticut, very, very wealthy gentleman, ran a massive, massive international company, and he thought and was told that that's the place to go. Went to Panama, spent a lot of money to fly there privately, spent a lot of money to go and get that done, and had no result. So it's just too much risk. Don't take risk with your health. Do not take any risk with your health.
Amen. Next question. Would stem cells help with muscle weakness due to a spinal stenosis? Haven't walked since 2021. I'm not paralyzed. I'm just very weak.
So stem cells will go to areas of damage and degeneration and make brand new cells where you have damage. But I need to see why the spinal stenosis is there. Is it central stenosis down the middle of your spine, your spinal column, where the spinal cord exists, or is it a foraminal stenosis on the side where the nerve roots come out? We'd have to find that out.
We already got our central.
Okay. So a central spinal stenosis, you know, you have the spinal cord that runs down through your vertebrae, and if that narrowing of that cord, a narrowing of that space is not relieved, the cord's going to become damaged. So yes, we can put stem cells into your spinal fluid, into your brain by doing the nasal droplet component, but you've got to remove that pressure on the cord. Otherwise, it keeps getting damaged. You know, it's like, you know, walking down the block and someone kicks you in the shins every time you walk by their house. If you get that cord is just hit over and over again by the narrowed, you know, spinal canal, you're going to create more and more damage. And I don't know how much damage you have. I mean, we do nerve conduction tests in the office where we can see, you know, how weak the nerve flow is going down to your legs, and maybe that's a good way to gauge how much a decrease in electrical activity you have from the cord, your brain to your cord, to the nerve root, and then to your muscles. But I want to be able to get you up and functioning again, so I would need to take a look at that, examine you and look at your tests.
Okay, I'm gonna see if they follow up on that, but we'll move on. We have one. My vision is blurry at night when I drive. My eye doctor claims nothing's wrong, but I obviously can see the difference. Could this be vitamin deficiency?
Yeah, absolutely, positively, without a doubt. I've said this every week for my entire career because I have so many people coming in, and I always ask them when I go over their blood work, but, you know, I could say, hey, do you have a problem with vision? I thought, yeah, how do you know? Because I'm looking square at your vitamin A blood test results. So, you know, I could make myself seem like I'm a wizard or something, but vitamin A deficiency is clearly correlated with a decrease in vision at night. And once we correct the vitamins, then you have a far greater result and ability. It may be time to give you a little bit of a teaser about vitamins. So I've corrected vitamins based on blood tests, rechecked the blood after I make the recommendation for every patient I've ever seen, in the better part of 37 years. And I don't know if it's 50,000 patients or so, probably. I've decided on a whole new idea, a better idea, rather than giving people recommendations to go get vitamins or people going out and buying vitamins in a store, or a bottle of this, a bottle of that, whatever. I'd rather use nutrients that don't have fillers, binders, excipients in them, make them as pure as possible. But I have the idea now, and I've spoken to my vitamin guy on this, and we're going to do this. I'd rather be able to have a little recipe sheet, and I'll show patients this. We'll put it on the air once I get that all set up, that lists all the different vitamins. And my goal is going to be packets that would be for breakfast, lunch, and dinner. Now, I can put anything I want in those packets, meaning I can put 2 multi for breakfast, 2 for lunch, 2 for dinner, maybe 1. CoQ10, 1 breakfast, lunch, dinner for people that have Parkinson's or neurologic issues. Maybe I'll do 2 CoQ10 breakfast, lunch, dinner, 1 vitamin D in the morning, maybe a D in the afternoon if we need to get extra D on board to create the result. Chromium, and I could adjust accordingly based upon your blood test. So it's unique to you, it's custom to you, it's based upon you and your blood test. If we need to have a little bit more vitamin A, I could put that in there because I'm not limited to bottles of things. I'm going to be able to put in capsules of whatever I want and need to do for you in these packets. So breakfast, lunch, dinner packets. Haven't figured out the colors of the packets yet. Maybe pink for breakfast, green for lunch, blue for dinner, whatever the colors are. Maybe little Ziplocs. But it's going to have nutrients specific to your medical condition and your medical need and your blood test. So it's a perfect way to get everything you need and you want with the right timing for the nutrients. You got to go out to dinner, you take the pack with you. Go out to lunch, take the pack with you. So, and of course, within a month of doing that, because it'll come in a box that's a month's worth and it'll have a list of all the vitamins and what the benefits are for them, we'll recheck your blood and prove that your levels are in the perfect range. So that's going to be the best way to tailor a protocol specifically to you, customize it to you. There's nothing that would be as good and as specific as that. So that's my new vitamin thingy. So we're going to talk about that every day we do the podcast. Monday, Friday, Saturday, we're going to have all this, bring it forth, show you what the recipe sheet looks like, and, make it work perfectly for you. So
just the idea that, when I'm going to take my vitamins, it's like, okay, I need 1 of these, I need 3 of these, I got to open each one,
right.
I got to get the right
it's
one.
Hard.
It's like just that convenience alone.
And think of, 90% of people that take vitamins are just taking what their friend told them to, or they saw an ad on TV, and they're taking something you take once a day, which never covers your requirement. It's just taking a lot of confusion and in some cases nonsense and making it into completely pure, scientific, perfect recommendation. Based on the blood test and your history, your symptoms, proven by the second blood test to show that it's hit the nail on the head. And all you have to do is just, as you get the box, take your breakfast pack, lunch, dinner, takes all the guesswork out of it and all the difficulty out of it. I think every patient I've ever seen is taking vitamins. Some take more, some take less, some take everything that they hear about, and they're taking 100 pills a day, which is not needed. Some people are taking too much of one because they think if 1 pill is good, then 4 pills are good. So you'll never get into the over or super high levels of vitamins that you don't need because it's going to be based and then retested to prove you're right where you need to be. So
we got someone on Rumble. They said, and half the time I don't know what I'm taking or why. I guess that's vitamin related.
So, I hear this every day it was 6 days a week for my entire career. So that's why we tried to make it into a smaller grouping of things that you need. But now with the little packets, breakfast, lunch, and dinner, it becomes perfect. It's a no-brainer. You take your packet for breakfast with your food, done. Lunch, dinner. And if we recheck and we still need to add another thing or two, I could do that. Instead of you buying tons of bottles at 90 capsules or pills or whatever, and having this massive array of bottles, vitamin bottles in your house, on your table, or wherever you keep them, it's just your packets, but it's perfect to your need. So we'll be talking a lot more about this once I get the recipe sheet, for lack of a better term, together. We'll show people what that's like. But it's going to work brilliantly, beautifully.
Brilliantly.
Brilliant.
We got one. Chronic migraines they suffer from. While some things may help mask them, I'm looking for a legitimate fix. Any thoughts?
The interesting thing is you're talking to Mr. Causes of all things, because I'm unrelenting at looking for finding, causes of things. Most of my patients that have migraine have some allergy component and have a delayed reaction to a food. And as weird as this may sound to you, and for some people are saying, yeah, I know that, it's right. You could be eating a food every day, every other day, but you're not getting an immediate reaction like swelling of your lips. If your lips swelled up and you bite into a food, you'd never touch it again. But it may take a few days before the antibodies start to build up and finally hit a threshold, and then your symptom occurs. It could be 2 or 3 foods together that are creating that hit at the threshold and your symptoms occurring. So with most people, and certainly if you told me you had migraines or stomach issues or whatever, we'll check to see if you have any antibodies showing up in your blood for allergy, although that's a screening test. It's a peak. It's not the final word. If any of those things pop up, or people say, I know I'm allergic to this or that, if we do skin testing on the upper arm, it's the most accurate way of looking at allergy, because you're putting the liquid allergen into the skin and waiting 15, 20 minutes, a half hour for antibodies to go bind to it. So you take those foods out of the diet and you watch to see different things change. We've seen people get rid of acne. We've seen people get rid of psoriasis. We've seen bloating go away. Of course, all sorts of weird things, joint issues, brain fog. So allergies propagated through your whole body, so through your blood. So you could have symptoms anywhere. Secondarily, some people are low in magnesium, potassium, that can help. Hormone changes, a variety of things can correlate with migraine. So we want to look as deeply as we can to find all the causes.
And just a response to that, they said, wow, I never thought of it like that. Most doctors ask me if I have neck pain, etc. This is already a different approach.
So, yeah, there are some people that have headaches and migraine and even cluster headaches where you have issues with the discs in your neck. At the top couple of vertebrae, you have your skull, the atlas, and the axis. So pressure on the nerve roots from the discs or muscle spasm or torque or tension can create pain up the back of your head, into your head. That's one cause, but it's not the most common cause. But I would look at all of that. Some people have had injuries or accidents and concussion bump their head. Well, yeah, that sets the stage for a more structural issue. But either way, no matter what, we test for all of those things.
We got a Rumbler said, this might be a far stretch, but are there studies with stem cell therapy and mental illness?
There are.
And then this show gets my gears moving. I love that.
Awesome. There are studies. There have been talk about people that have anxiety, depression, even schizophrenia. I haven't looked lately, but, I'll go on as soon as the show's done. Google Scholar, and you could do it, Frankie, if you have a sec. Go to Google Scholar and look up stem cell therapy for schizophrenia, stem cell therapy for depression, anxiety. And the reason I say this with confidence is that I have a lot of patients where we've treated various conditions with stem cell. Some people we do IV because they're diabetic, and we want to get the stem cells to their pancreas, their heart, lungs, liver, kidney. When you do IV, it goes to all your organs. It gets off the train, your blood flow, sets up shop, and goes right to where the damage is and creates brand new cells. But it's interesting to see when you do IV stem cells, which is now, people are asking for this, even they may not have any significant medical issues. They just want their organs and body function to be younger. It's like the new thing, people saying, hey, I don't have any major problems, but I want stem cells. I want to have younger functioning organs, which is wonderful. But anybody who does the IV, I give them a handout, a symptom checklist. I say, write down everything from your hair down to your toes. Whatever you feel is wrong. Your hair is thinning. It's not as thick. It's graying. It's my memory, focus, concentration, word retrieval is not great. My mood is not great. My vision, color vision, smell, taste, heart rate, breathing, name everything you can, and then show me month to month, because we follow them up, what's changing. Invariably, you get 6 or 7 or 8 things that are better, including mental clarity, focus, mood. So for MS, Parkinson's, Alzheimer's, stroke, you're putting brand new brain cells to where the damage is, because stem cells become brain cells. And now you're making more neurotransmitters for your brain. And invariably, those people talk about far greater brain benefit because we're dripping it, one syringe at a time into your nostril to hit the back of your nasal cavity to get it to your brain. So, yes.
And I'll just say 181,000 studies on Google Scholar for stem cell therapy and schizophrenia alone. So
181,000. That's pretty staggering. I look at this stuff because I like to tell people similarly. We talk about vitamin D research, 4.5 million, vitamin C research, 5 million, millions on stem cell therapy. And when you look at the research, the numbers are there. It's just massive numbers of studies. I'd be willing to say that stem cell therapy itself has more research than any other therapy that I've seen online because it's so applicable for all these things, for psychological and psychiatric effects, any of the organ decline diseases, all these things, joints. So there's stem cell research on virtually every degenerative disorder.
All right, we got this one from Reddit. What advice do you have for those who have parents with hypothyroidism or hypothyroidism and are trying to avoid potential issues for themselves?
Well, hypothyroid is extremely common, and we're seeing that more and more over the years. I've seen it more and more in the last decade, and I think there are things that correlate with that. And part of the picture, I think, is heavy metal related because I think metals, we're exposed to all this stuff in our foods, in our deodorant, and perspirant. Metals are all over the place. So I think metals damage your organs, including your thyroid. For people that have fillings in their teeth that are silver fillings, those are 50% mercury, and that mercury is inches away from your thyroid. So that material can get into the blood vessels in your teeth and just get right to your thyroid. There's literature on that, traditional medical literature on heavy metals and mercury damaging your thyroid. So we see this all the time. In a perfect world, if we see that a person's got a decrease in T3 or T4 and an elevation of TSH because your brain's asking for more thyroid hormone, we, of course, might recommend using iodine. We, of course, might recommend using some of the natural thyroid, Armathyroid, NP thyroid, etc., USP or compounded thyroid. But also I'd like to look at the mechanism for the heavy metals and see what you have on board through blood and then a urine test. Blood tests look at 5 metals, urine tests look at 21. Urine's a better reflection of what your body's storing because blood is just free-floating. It didn't really get stored yet. So we may also need to do something to remove the metals to take that away from causing some of that damage. Again, it's a more comprehensive exposure or approach to the thyroid mechanism.
Okay, and then we got one from Reddit. What is the best thing a woman can do to prepare her body for childbearing?
Oh, this is a great question. There are a few things that are very, very important. A ton of exercise. Get a lot of oxygen flooding into your cells. Have your vitamins and minerals tested beyond perfect levels of vitamins and minerals so your body is flooded with those things to make you healthy. The exercise is also great for your immune response. Do a lot of stretching. There are now places that open up that stretch you out and, do all sorts of things. Work on your low back, stretch your low back, because what will happen, as you get pregnant, the ligaments of your back and your hips and the, pubic and pelvic areas are going to stretch out. You want to make it so that they're healthy and, will adhere and work with that stretch as opposed to being tight and then that stretch forced upon them over the 9 months of becoming pregnant. Some people will work on their skin, and I've known some people that'll do a variety of things to keep the abdomen and the belly skin, soft and pliable. They'll use, I think it's called Clarisonic. Sabrina, we need a little consult. That Clarisonic is the ultrasound device you scrub your face with?
Yes, it is.
Clarisonic. Thank you. So Clarisonic is this thing that just vibrates an ultrasound. It scrubs your face and your skin, and you can put a CoQ10 or a vitamin C scrub to make your skin all wonderful. But there are women that use that to do that for the abdominal skin and massage it and try to make that, ready for, the stretching that occurs with pregnancy. But probably the most important thing is testing your blood for vitamins, minerals, all of that.
All right, back to Rumble. My husband gets reoccurring sinus infections in the winter and is always prescribed Z-Pak. What would you suggest would be the best thing to prevent this altogether?
So this is a pretty cool comment that I say to most of my patients, because over the entire career of seeing people who get that same cold every year in September or the same cold every year in November, December, it's interesting how I figured out how to track this stuff. So when some people have allergies through spring into the fall, you're using so much of your immune time, and that allergy inflammation of your nose or sinuses or wherever becomes a spot where bacteria or viruses like to get and dig in. And we've had people that get the same infection every September that are very allergic to ragweed. So the ragweed season of June, July, and August predates that same infection. We've worked on correcting the allergy mechanism, and in many of those patients, they don't get that infection. Bizarre, but true. Yet other people, when they come in, they have infection who are not really dying to take antibiotics for every symptom they have. We'll talk about doing some vitamin IVs. Vitamin C IVs help to kill virus. There's a ton of literature on Google Scholar for that. I think there's 1,500,000 or 600,000 studies now. If you go to the search box and put in intravenous vitamin C therapy, helping to inhibit cancer, kill COVID, Epstein-Barr, shingles, all these things. But the interesting thing that I've told patients about over all these years is that if a person comes in to do a vitamin IV, or 2 or 3 of them when they're sick, and it knocks out that bug or that flu, which in many cases it does, as soon as they start to feel something coming and brewing, they'll come in and get a couple of IVs and knock it out. And I have many thousands of patients who've said, since I've done those IVs and I'll do them once or twice a month in the winter, I don't get those colds anymore, because you're quadrupling your killer cells by raising up your vitamin C in that fashion. There's research on that, medical research, raising up your vitamin C. So 60 kilograms of vitamin C, 60 milligrams of vitamin C per kilogram of body weight, which ends up being 4,200 milligrams, can help to quadruple your killer cells. Great study. And the vitamin IVs obviously have more vitamin C, 25, 50,000 milligrams. So the point is, you can prep your body and get your body strong and then see that those things, infections, aren't happening. Just like a woman who has issues with iron deficiency, and we prep in the same way where we say, your iron has been low and you really drop when you have your period. Let's take 1 capsule of iron every day, but right before, the week before you're going to have your period, let's take 2 or 3 capsules to raise your levels up. So when you lose that amount of blood, you're not bottoming out the iron, you're dropping down, but you're still in the normal range. So it's kind of a little trick or a way to prevent that significant, drop of iron. There are ways to do that.
All right, what else we got?
888-420-9272. If you'd like to call in, you could do so now. 888-420-9272. Let's talk for a moment about high-risk plaque. So plaque builds up in your blood vessels. Everybody knows that. The majority of people throughout the world will die of some event that will stop their heart. And sometimes it's plaque, it's a clot, etc. Heart attack, stroke. High-risk plaque is that which is likely to rupture and create that clot. Ulcerated plaque is a term that used to be used because it looks kind of like an ulceration. So if you think that blood pumps, through your blood vessels, excuse the sound, that's the only sound I could make with blood pumping. Whoosh, sounds better. So if the blood is flowing through and it's hitting plaque, and if you could zoom in on this, the blood flow may hit a bifurcation, a split in the blood vessel, and the plaque in the middle there has pressure, a bulkhead of blood hitting it. If there's loose plaque, it can knock the plaque off, and that can create a clot somewhere or a stroke. So what's the idea behind cardiac testing? Well, we love to test people and do sonograms of the neck looking for plaque. If there's significant plaque there, we may do an MRA, which is a better test for defining the plaque and looking for ulceration. We also look at lower extremities, abdominal vessels, echocardiogram to look at your valves, how they open and close, how much contraction your heart has pumping out blood with each contraction of the ventricles. But you have to do this. And especially as people get older, you want to listen to see if you hear a murmur in their neck, or see if there's any cramping or pain or issues in their legs or ulcers on their legs or rust-colored legs because of poor circulation. Red blood cells are breaking, iron's leaking out and staining your skin. You want to do a vascular evaluation so we can see where your risk is. And if the ulcerated plaque is there, we've got to deal with that. So important to look for that. And then you're going to save people from having these sudden death phenomenon in many cases because you're going to work on that issue so it doesn't become a problem.
Okay, good one from YouTube. In a previous show, I asked about colitis. I want to know if someone with colitis can undergo the stem cell therapy while taking their immunosuppressant medication like Humira, or do they have to stop? And also, how long is the treatment? How many times do you have to do the SCT, or is it one and done situation?
So you don't stop your meds for anything that we treat, because if you have high blood pressure, you've had a history of a stroke, diabetes, whatever, you don't stop your meds. Everybody keeps taking their meds. We do the stem and watch to see the improvement. For those people, it's easy to talk about diabetes. If their blood sugar is 300, we come in, we do stem, and their meds aren't doing enough, and you start to see the blood sugar drop, and you start to see insulin levels come up because you're making new cells at your pancreas. You could easily see that on your blood. You're watching that change, and that's what stem cells will do. There's a great video on the website. One of the patients, young gentleman's name is David, and you could see that he had ulcerative colitis for many years, since he was 21. And he was afraid to go past, a relative's house because driving any further, he was afraid to have an issue with an accident while he was driving the car, a bowel accident. So ended up having one, came in, we did it. And the first day or so after doing the stem, he had a normal bowel movement. His bowel's been wonderful ever since. So people typically do one stem cell treatment for all the things that we do. If they want to do another one a year later, 6 months later, you can. You can do it as often as you want. They're your cells. There's only benefit to that. There's no downside or risk or side effect. So you don't stop your meds until you have such significant improvement that we can say, okay, let's start to wean your meds back down and see if you're still holding and still doing well, whether it's diabetic or otherwise, cardiovascular, kidney decline, whatever. You don't change the meds until you see the new benefits. So the procedure takes 1.5 minutes to extract the stem for the crest of your ileum. We spin for a half hour, and then we do the IV, and they go right back into your body. So it's all done within the hour. Were there any other components of that question?
I think you hit it all. Did you respond to the one and how many times do you have to? I guess that was answered.
Yeah, most people do it once. And I don't tell people you have to do it this many times. You do it once and see how much benefit you have. And some people do so well, they don't do it again. And yet other people say, I'm 75% better. My life is back to normal now. But you know what? I want to do it again. So you can. It's all beneficial. We do it for facial rejuvenation. We do it for hair, all the organ decline and degenerative disorders.
Incredible. Okay, let me just do a sweep.
So should we talk about this marriage weight gain thing?
It might be time, Doc.
Okay, I think it's time. Let me just say, once again, this is a study published in WebMD and done through the National Institute of Cardiology. And it was a Polish study that ran contrary to some other studies. And there were many thousands of people put into this study. And this is not a comment coming from me or Frankie or from anybody in this room, Sabrina as well, or people that I know. But it's an interesting commentary. Now, for many years, I have tons of friends that are in relationships and married and such, and the husband seems to say, oh, when I got married, I gained all this weight. And yeah, maybe that's so. And I talk about, men when they're single, they're just not great with their diet. They don't really make their own food unless you're some wonderful chef. And you're eating whatever you're eating. And then you get married, and all of a sudden there's this wonderful person there for you all the time, and you're just getting fed a lot more good food. And you're going to eat that food, and your wife's putting all that love into the cooking, and you're putting the love into the eating, and you want her to see the love for her cooking, so you eat more maybe. And, maybe you don't have as much time to do the exercise you did before or go to the gym. There are lots of things going on here. But this study, not my comment, talks about, is marriage making you or your husband gain weight? So it seems that in this study, the average age of men in this study were in their 40s and 50s, that married men are 3.2 times more likely to be obese. Now, obese is not 10, 15, 20 pounds. 3.2 times more likely to be obese than their unmarried counterparts. Obese is a big word. No pun intended. But the trend did not really apply to married women. So why are men gaining all the weight? Researchers their findings are published at the European Congress on Obesity in Spain, that cultural differences in attitudes towards obesity exist. What does that mean? I don't know. Marriage appeared to increase the likelihood of being overweight. Now, overweight's not obesity, but overweight could be anywhere between, a few pounds and a lot of pounds. 20 pounds, 30 pounds, whatever the number is. I'm not even going to go there. 62% in men, 62% of men are overweight. And what do we say? 3.2 times more likely to be obese. There's overweight and then there's obese. I've never been to Poland, and I have no idea what's going on there. I know there are certain Polish foods that are good, but I don't know.
I'd be curious on the Italian study.
This is very interesting. Past studies, let me make a comment on this, have consistently shown, and I'm reading this line to line, obviously, that married men tend to have healthier lifestyles, of course. They're often influenced positively by their spouses, of course. Research showed married men lower rates of smoking. I don't want to say because the wives hide the cigarette packages or take them away or threaten them. I don't know about any about that. Reduced alcohol consumption. That may be so. Maybe in some cases it's not. But overall, reduced alcohol consumption, they're hiding the bottles. Increased likelihood of seeking medical care. There are different ways to look at that. If you start to smoke and drink, you get hit over the head with a broom or a slipper, you're going to need medical care, right? So
it's also easier to have one person to say, I think you're overreacting. You don't have to go to the hospital, and you don't, right?
Exactly. So there's a lot to be said. I want to follow that up, and we'll make some comments upon that. I'll look at studies done in other countries and see if the same holds true. But pretty interesting.
I'll just say that we've only been married for about, 8 months, since August, and it didn't take my wife very long to say, yeah, that makes sense, that study.
I mean, and let me tell you something. I can talk about what she cooks and she shows on her Instagram pages and such.
Oh, yeah.
Anybody married to her would be 300 pounds by now.
Thank you.
With all that food, I mean, it's the most appetizing, delicious food I've ever seen, posted online. So how are you not 300 pounds?
Thank you. Finally.
You must be running around like crazy. Treadmill, indoor, outdoor, running with the dogs. The dogs aren't overweight, so any rational man would eat all that food that she makes because it looks so good. So, yes, Frankie, you're a star. Sabrina, you're a star for making all that awesome food. But I don't know how you do it, Frankie.
Neither do I. Come back to me in a year. The audience is going to say, "Whoa, what happened?"
Well, we'll have to do our own study.
Yeah, there you go.
It'll be the podcast study of wherever we are, Dix Hills, Deer Park. The podcast married diet study. Okay, 888-420-9272 if you'd like to call in and ask a question. No screaming, please. If you'd like to text us or send us an info question, we'd love that. Thank you for our Reddit, Rumble, all our podcast listeners on all the stations, Amazon and Pandora and all these other names that I don't know.
Yes.
YouTube, TikTok.
Just found an Instagrammer. What can be done for chronic constipation? I am on Monjaro Instagram.
Monjaro and some of the injectables weekly can cause a little bit of stomach irritation, sometimes a lot, upset, indigestion, difficulty with reflux to some extent. And some people will use antacids to calm that down, but constipation is slightly a different mechanism. And remember, when people do diets, when they're on these injectables, they're trying to get rid of foods that are keeping their blood sugar high or trying to, maintain their weight when they're trying to lose. So a lot of people get constipated when they cut out, carbs, grains, fruit. I think when you do the injections, you should do low carb, but you should have some of the berries in your diet, a lot of fiber vegetables in your diet, because that helps with that function. Some people like to use Senecot. They have gummies that will help you move and go to the bathroom. But there's not one recommendation that works on everybody. Some people say, I use fiber, psyllium fiber. Some people say, that doesn't work for me. I like prunes. Other people talk about something different, magnesium citrate, glycine. I mean, there are lots of different things you could use. It just depends on which is going to work for you. And drinking a lot of water helps, because if you're dehydrated, you're going to have a hard time going to the bathroom. So sometimes you have to run through 5 or 6 different things to see which is going to work best for you. And you have to exercise and do muscle exercise on the injectables, because some people that don't do exercise, their muscles become very weak.
All right.
Well, I'm surprised there aren't married people calling in and yelling.
Oh, this is a follow-up on Instagram. I asked about GFR levels is 44. Is that normal?
No. So, and depending upon age, the GFR categories, 1, 2, 3, 4, 5, 6, or 1, 2, 3, 4, 5, are categories that describe decline of kidney function, CKD, chronic kidney disease. So category 1 may be, normal is 90 or above. That's perfect. 80 to 90 or 70 to 90 is category 1. 60s to 70s maybe category 2, category 3, another 10 points or so below that. So you don't want your kidney decline to continue to happen, because the lower it gets, the more that the nephrologist is thinking of doing dialysis. In a perfect world, and this is what we've done, is we do stem cell therapy for kidney decline, liver, kidney, heart failure, all the degenerative disorders. And stem cells will go in, get to your kidney, because it's making signals of degeneration or damage. The stem cells get to your kidneys, become brand new kidney cells, and now you have better kidney function. So that's an important recommendation as your kidney function declines. And it's weird, because in the past 7 to 10 years, I'm seeing way more kidney decline than ever before. Are there things that may be associated with it? Infection or injections? Yeah, maybe. We have to look at reality. Look at literature around the world. There are a lot of studies coming out about bad things happening. So we have to look at that, have to understand it. And we have to see if that's happening in these populations.
All right.
Let's take a
last call for y'all.
888-420-9272. Let's take a couple of emails from the website. Let's talk about, Tim is 35. He has headaches and chronic neck pain. Not sure why it's there. Well, the overview would be, and certainly as I look at range of motion of your movement in your neck and your head and palpate and evaluate, we certainly want to see whether or not you have either muscle spasm or you have ligament laxity or weakness. Then your muscles are becoming tight to hold you in better position. If the ligaments have become weak over time and you have grinding on the disc from your vertebrae, the bones grinding down the disc could hit the nerve root, and that can create problems. So an MRI is the best test for that. So that tells us, is your neck contributing to the headaches. And lots of things can cause headaches. Food allergy, injuries to your head over the years. You got bopped in the head one way or the other, fell off your bike, car accident. We want to look at all that and that mechanism, and certainly look at the allergy picture too. If you have issues within the ligaments and tendons of your neck, we could do PRP, we could do traction, we could do stem. So it depends upon, what that workup, looking at all the underlying causes, is going to show us. As I mentioned before with migraines, a large percentage of people that have migraine and migraine-like headaches, even regular headaches, might correlate with a food allergy or a deficiency of a vitamin. Also, take a look at our previous podcast with a gentleman that had cluster headaches, suicide headaches. One stem cell treatment, was it 5.5 or 6.5 years ago? He had that done. He's up in Canada, Nova Scotia. He's got a wonderful barbershop, Chinwag Barbershop, and his life is completely back to normal. And they did drilling into his brain, putting electrodes in. They did all this crazy stuff. And one stem cell created a dramatic change, and now his life is back to normal. But you could watch that interview on the website. You could watch the video on the website, interview on the podcast. So it can be pretty dramatic when you're looking at repairing your body using your own cells to do that. Let's see, for Ben, epicondylitis, golfer. So playing golf, you could either do it in a very simple, nice, easy, general fashion where you're swinging easy, or swinging like you're going to chop down a redwood tree. And a lot of people that swing hard and fast are going to create wear and tear on the ligaments and tendons that hold your elbow bones together, your radius and your ulnar, and your humerus. So the ligaments go bone to bone, tendons go muscle to bone. So that whipping effect of hitting the ball at the last minute sometimes is putting a lot of pressure on that medial epicondyle. So for that, as we do the MRI and we see wear and tear or fraying, we could either do PRP if it's very mild or do stem cell. And you're putting cells in to create growth and repair so that you're weaving in new tissue to create repair in that joint. So that would be your most important step. We've spoken about low back pain and sacroiliac issues. Jack had a question about that, but we talk about PRP or stem for sacroiliac ligaments to create strength and stability. Morgan wants to know about weight loss. She's tried a variety of things. So weight loss, in my mind, has to be covering every base. Low-carb diet. Some people don't drop their carbs low enough. You've got to be 30 grams or below to be able to get your body to burn the fat. Exercise has to be a half hour to 45 minutes of nonstop activity. Indoor bike, outdoor bike, walking around the block, slow, brisk, fast. Walk out 3 blocks, go 4 blocks, go to the park, laps around the park, come back, whatever you want to do, whatever geometric plan you have in your neighborhood. Correcting hormone decline. A lot of people don't test all the hormones. They'll only do T4 and TSH for thyroid, where you'll need to look at 10 to 12 different things, including T3. A lot of times T3 is low, and once you raise that back up, people start to lose the weight. Some people are just at that borderline where they're about to lose the weight, but didn't know some of these specifics, and they're not getting the result. So low carb, exercise, correct hormones, vitamins and minerals. And for those people who would like to do the weekly injectable, you could do that. Not hard to do, but we have to track your blood. Silvio wants to know about hair loss. Well, hair loss occurs for a variety of reasons: low levels of hormones, vitamins, minerals. Male pattern baldness occurs where genetically you may have a decrease in the ability to maintain your hair. So there are a lot of things that can be done. For some people that have severe hair loss, there are techniques to take some of your hair from the side of the back of your head and put it in because it's permanent hair, and that can make a difference. We've also offered stem cell therapy injected into the scalp for individuals as well, but you can't come in bald thinking you could have a full head of hair. So there are different things that we may do. We may recommend collagen peptides, maybe the capillus cap, which sends that light, the laser, to your scalp to help stimulate your scalp. There are creams and gels you can put on your scalp that have minoxidil, finasteride in it to block the dihydrotestosterone. So we have a pretty good protocol for that. 888-420-9272. Any last questions, thoughts, comments?
Nope, no questions left at the moment.
We'll talk about the whole custom vitamin recommendation thing again on every show now, Fridays and Saturdays, so people can understand it. And if you can get a chance to call and ask a question now, just email the website at drcalapai.com, and we'll get your emails and answer you and chat with you and get you set up.
Let's see.
A couple of other projects on the plate.
Oh, yeah.
Working with a big organization that administers to Medicare patients in some large facilities, not nursing homes, either elder care or at home. And I've created a mechanism to be able to do telehealth with them. And for those people who need what's called RPM, remote patient monitoring, where we can send a blood pressure device, a cuff to your house. We could send a glucometer to your house so you can check your sugars, a scale, obviously, to track your weight, et cetera. And all these things report back to a information gathering mechanism so we can check and see how you're doing. There's also a watch that's come out that checks your pulse, your oxygen, just like a pulse ox device, can make a little EKG reading. It's got a lot of wonderful information. Some of them may also be able to look at balance to see if you have issues where you might be falling. And this is a great way to keep in touch with patients, whether it's a weekly basis, depending upon need, and being able to prevent these big issues from happening where they become really sick and then they've got to go to the ER for this massive, workup. So if we can have a connection with you that way, it's a great way to try to, track you and keep you healthy. We're also trying to see if we can get the lab to be able to go to persons' homes to do blood work. So we're working on it. I don't know exactly when it might start. Another project is working with a lovely woman who has a nursing service that will go to people's homes. And she's been doing it for the better part of 15 years. If we work with her and those people need, as they obviously would, the medical telehealth mechanism, we could set that up, get blood work done, and be able to help people at home. I think that a great deal of medicine in the future is going to be primarily telehealth. A lot of people can't get out to go to the doctor. And if you could have this connection and we can get you on vitamins based on your blood test and all of these things, we could keep you very healthy and prevent these issues from occurring where a person's blood pressure goes out of control and they end up in a hospital or they end up with a heart attack or something like that. So if we can track and see that your balance is an issue, then we want to understand it, figure it out, get someone to help. Your specialist will have to know if you're having some issues with irregular heartbeat so we can contact your cardiologist, et cetera. So we're trying to put this all together to make this work. And it's coming along. May take a little bit of time, but it's coming along nicely. And then we're working on dealing with helping more veterans. Josh, who's one of the veterans that I treated, has been diligently working with some of the veterans organizations to have them get patients in for stem cells for traumatic brain injury. So we're doing a lot of different things all at once. Thank you for listening to the program today. God bless you all. Have an amazing day. Email us, website, drcalapai.com. Please like, follow, subscribe, share our information so your friends and family can see it. Office number 516-794-0404. We'd love to help you out. Bye-bye now.